Motion number 4, limiting choice and competition, and move to dispense with reading of the amendment.
So ordered.
Mr. Chairman, thank you. I'll tell you what this motion does. It prevents the government from limiting the freedom of individuals and families to choose a health plan that best meets their needs. And it would prohibit the federal government from controlling health plan choices or restricting competition among health plans. Throughout my town halls and I listened to some of yours on C-SPAN, so I know that this came up all over the country. People in families and communities, not only in Wyoming, but everywhere, voiced frequent anxiety about this health reform effort because they're concerned that the federal government will interfere with a family's choice in doctor or health plan. Now, I agree with President Obama's promise that he made over and over that if you like your plan, you can keep it. But quite frankly, this bill doesn't do that. Neither the House bill nor the Senate bill does that. So for crying out loud, I would think the Democrats would support this to help justify and support the president's promise. The Democrats' plan requires not only that all Americans purchase health insurance, but also delegates to a huge bureaucracy the unprecedented power to create and change the requirements for bureaucrat-approved health insurance. The Secretary of Health and Human Services, together with the unelected Health Benefits Advisory Committee, will have the power to decide what health plans will allow individuals to escape the tax penalty for not purchasing bureaucrat-approved insurance. The Democrats' plan would effectively eliminate the individual health insurance market. If you had a plan in the individual market now, and your plan does not meet the Secretary's new mandates, you'll lose your health plan. Now, the CBO has said in their updated estimates of the Senate-passed health bill that up to 10 million people will lose their health coverage under that legislation. Now, will the new bill that is going to come out of the Rules Committee, if we pass this and send this to Rules, provide something different? Well, of course not, because this is based on a wide philosophical divide between the most liberal wing of American thought and the rest of us. And we don't know what you're going to do, but we know that Nancy Pelosi will let us read what you're going to do once the bill passes the House. This, after we know that this bill affects every single person in America, 1/6 of American economy. And yet there's no guarantee in this bill anywhere that if you like what you have, you can keep it. This motion is designed to remove this uncertainty and preserve health care freedom and choice. Now, let me give you an example of what's going on in Wyoming. In my home state, the ink is barely dry on a new state law signed by our Democrat governor to create a pilot program for covering low-income populations. The new program uses a personal savings account model with contributions from the state government to help uninsured individuals pay for health care. Now, some of the details still need to be worked out, but the legislation that created the program was done by people who feel they can design a coverage mechanism that is more affordable for our state than Medicaid, and also more effective than Medicaid in reaping cost savings associated with preventative care. For example, in Wyoming, we know from studying 100% of the children in Wyoming on Medicaid that it would be 2.87 times cheaper to buy every single child on Medicaid in Wyoming a Blue Cross Blue Shield insurance policy than it is to keep them on Medicaid. We know it because we surveyed 100% of those kids. That's the beauty of being from a small state. They're trying to give Wyoming's uninsured residents control over their own health care dollars, a stake in keeping their costs down, and incentives to seek care before they end up in the emergency room. As Wyoming's government proceeds with this plan, they shouldn't have to worry about whether or not the coverage they create will help the participants in this pilot project avoid a federal tax penalty because of this federal program that dictates what will be acceptable insurance. They shouldn't have to be concerned that they might disagree with the Health Benefits Advisory Committee on what acceptable coverage looks like. They should have the freedom as a state to design a coverage mechanism that makes sense to the unique characteristics of the Wyoming people and certainly to their uninsured population. States should be the centers of healthcare innovation. We've seen it over and over with programs like welfare reform, which began at the state level and not be dictated by bureaucracies in Washington. Employers who provide coverage should be able to explore different ways to structure their health plans, including ways to incentivize wellness and adhere to preventative care regimes. Most importantly, health care decisions should ultimately be made by individuals and families, not the federal bureaucracy. With that, I urge my colleagues to support this freedom-preserving motion, and I yield to my colleague, Representative McHenry.
I thank my colleague.